Let's take some time to reset and strengthen our documentation standard. We want to make sure that our notes don't just summarize what happened, but show the clinical depth of the session. The goal isn't longer notes, it's clearer notes. Your documentation needs to, 1, show medical necessity, 2, show the intervention used, and 3, show measurable client response. So statements like progress was noted, client responded positively, or skill acquisition was observed are a good starting point, but they don't tell the full clinical story. If an outside reviewer, insurance auditor, or state auditor picked up that note, they should be able to reconstruct what happened in the session without guessing. Instead of writing emotional awareness increased, write something like client identified 3 psychological signs of anger and independently labeled the emotion before escalation. That level of specificity protects you, protects the agency, and demonstrates your clinical skill. Every BIRP note should clearly answer things like, what behavior did you observe? What intervention was used? How did the client respond? Was it measurable? How does it connect to the treatment goal? If your note includes observable behaviors, measurable data when possible, named interventions, and a clear goal connection, it's strong. This isn't about compliance for compliance sake. Strong documentation demonstrates medical necessity, reduces liability risk, supports reimbursement, shows your clinical value. Vague documentation creates vulnerability. Specific documentation creates protection. Strong notes include observable behavior, what we saw or heard, measurable elements, frequency, duration, accuracy, intensity, named intervention, client response, clear link to goal. When documentation reads like someone could reconstruct the session without being there, that's audit ready. We want to raise the clarity standard, not word count. Clarity. If you're unsure whether something is detailed enough, ask yourself, could someone who wasn't in the room picture this session? Here are some example statements that move from vague summary language to observable, measurable, defensible documentation. Number 1, instead of Kinsley remained cooperative during practice, try Kinsley followed all 3 role play prompts without refusal, maintained seated posture, and completed each rehearsal step within 30 seconds of instruction. Why it works. It defines compliance behaviorally, followed prompts, time to respond. This meets behavioral documentation standards, requiring observable, measurable language. Number 2, instead of responded positively to praise, try following verbal praise for using coping skills, client smiled, stated, I did that better, and maintained engagement in the task for an additional 8 minutes. Why it works. It identifies effective change and sustained engagement. This demonstrates clinical impact of the intervention rather than opinion. Number 3, instead of skill acquisition was observed, try client independently demonstrated the 4-step problem-solving model. Identify problem, generate options, evaluate consequences, choose response, with 80% accuracy during role play. Why it works. It names the specific skill and measures accuracy, 80%. That demonstrates competency development rather than a general impression. Here are 3 BIRP documentation upgrade adjustments you can make. When writing notes, pause if you see one of these phrases. Replace it with observable, measurable, interview-linked language. So for example, number 1, client was cooperative. You can replace this with what directions were given, how many prompts were needed. You can write down whether the client refused, delayed, or complied immediately. Ask yourself, what did cooperation look like? Number 2, responded positively. You can replace this with observable behavior change, smiled, leaned forward, verbalized insight. Duration of engagement, reduced avoidance or resistance. Ask yourself, how do I know it was positive? Number 3, improvement was noted. You can replace this with compare to what baseline? Frequency before versus after. Intensity change. You can ask yourself, what data shows improvement? Remember, strong documentation is part of being a strong clinician. What you're doing in sessions is valuable, and your notes should reflect that.